Welcome to Peace of Mind on the DEOS podcast, where we discuss important issues that matter. Issues that matter. And here we shall be very intentional about creating awareness with regards to a particular aspect of your life, which is mental health. We find ourselves in a world today where there is little or no awareness with regards to mental health. So when we say peace of mind, what comes to your mind? Pope Francis of blessed memory would say that peace is not just the absence of war, but the freedom of the mind and the tranquility of the soul. So we shall be talking about certain mental illnesses, certain mental disorders, and particularly today we shall be delving into depression. Oftentimes people attribute mental illnesses or mental disorders to one cause or the other. Sometimes there are spiritual interpretations to mental illnesses or mental disorders. We call that in psychology oftentimes external locus of control, when we try to feel that there are certain external forces that control whatever events that happen to our lives. So today we shall be talking about depression. Depression is considered as the malaria of mental health. And so as much as possible, it is something that we need to consistently create awareness about. With me on this episode, I have a very able and proficient clinical psychologist. Her name is Fanan Yashi-Nyakan. I hope I'm correct.
Yes, Father, you're correct.
And I remain your host, Reverend Father Istifanus Sheyin. So like I said already, we shall be talking about depression. Fanan, you are welcome.
Thank you, Father. It's so good to see you.
Yes, good to see you too. So we shall be talking about depression. This is what we've been doing all this while, creating awareness with regards to mental health. So in a layman's language, if you are to explain what depression is to a layman, somebody that has not heard of depression before, what can you say depression is?
Okay. Thank you very much, and it's an honor to be here. So, to your question, I would agree with you that depression is like the malaria, when it comes to mental health. It's something that is really common, but it's not normal. It shouldn't be there.
Yes, it
Yes.
shouldn't be
So,
there.
so depression is a mental health disorder. It's a mood disorder. I'm trying to break it down as much as possible. It's a mood disorder that can affect, an individual. And what are the things that you're going to see and say that, I'm depressed? I know a lot of times we use the word almost
Sometimes
carelessly.
interchangeably with sadness, sorrow,
Exactly.
and all that.
So someone is sad, they say, I'm depressed, I'm depressed. This is not Nigeria, everyone is depressed and all of that. But when it comes to clinical depression, when you want to diagnose, a patient or a client of depression, so you're looking at the mood. This person is usually a happy, lively person, energetic and all of that. And all of a sudden you notice that, this person's mood has changed. It has gone low. So this person is experiencing low moods which are consistent. So this is different from, I'm sad.
Yes.
And,
Yes.
someone
True.
could just say, I'm depressed. So that low mood is consistent for a period of time.
Yes.
We'll talk about it anyway. It's consistent for a period of time. You also have, this person having concentration issues. A lot of times you have people having sleep issues. They are not able to sleep. For others, they are sleeping too much.
Yes.
Okay.
Okay.
There's a part. So what is okay for me? Maybe I'm usually somebody that likes sleep.
Okay.
It's different from you.
Okay.
Maybe you're someone that can do well with, about 7 hours of sleep. For me, I have to do like 9 hours. So my own and your own is not different. So you're
Yes.
looking at, it's not the same. Rather, you're looking at that individual. How has that person's personality been before you're able to say, there's a change? Whether the person is sleeping too much or eating too much. Basically, there's a change in appetite. There's a change in sleep patterns. There's a change in concentration issues. And
Yes.
in rare cases, but serious cases, you have people having suicidal intent.
Okay.
So you're thinking of, you're so sad, or you're so, your mood is so low, the energy is so low that, you feel like, well, why don't I just end it all? So those are the things that you hear.
Okay.
And you could start saying, well, maybe this person is tilting towards clinical depression.
Depression.
So all of these things are, these are some major symptoms that you could use.
Okay.
Yes.
Okay, I shall come to discuss more elaborately on the symptoms of depression. So, in summary, depression is simply a mood disorder,
Yes, it
right?
is a mood
That is
disorder.
characterized by prolonged sadness, so to speak,
Yes, yes,
kind of
yes,
prolonged
yes,
sadness.
yes. Putting
And
it in layman terms.
oftentimes basic characteristics of depression, you mentioned low mood,
Mm-hmm.
low energy, and then importantly, loss of interest in activities once enjoyed,
Exactly.
which lead to the suicidal thoughts that you are talking about. Oftentimes people say that suicide is the end product. Suicide is the end product of depression,
Yes,
so somebody who is depressed, there's every likelihood that the
yes.
person would have suicidal thoughts. So we are still having this discussion. Now let us delve into many more symptoms of depression, signs and symptoms of depression. What are some identifiable signs and symptoms of depression that we can talk about as far as depression is concerned?
Okay, so basically we've talked about those
Yes, you have mentioned
signs.
some of them
Yeah,
actually.
yes, yes. So you could see someone, like I said, is a difference from what that person has been before, and then
Okay,
what is the difference that you're looking at, and
okay.
then yes, there's lots of interest in activities that this person used to
Yes, used
enjoy.
to enjoy.
uh ba- Majorly, or most importantly, you're looking at this person's sleep and appetite, because no matter how much a human being is able to function, if these two things are not there, then you know those
Yes,
are those are just the foremost
yes,
things to look at. So there's a change in appetite. So for someone, they may be eating too much. For another person, they may be eating too small from
yes. Okay,
what they would usually do. And then yes, another thing is that depression can lead to psychosis, or can happen alongside
so when you say
psychosis.
psychosis,
uh
explain that to the common man,
okay,
our audience out there,
okay,
our viewers out there.
okay.
Explain what is psychosis.
Okay, so I hear a lot of people, say, this one is psycho. This one is psycho.
Yeah,
Okay,
right.
but definitely I will try to explain it, from the professional point of view. So psychosis is basically a loss of touch with reality.
Reality.
So what are the things that you would look at and say, this person has lost touch with reality? What are this person's beliefs like? So you
Okay,
have delusions. So
okay.
these delusions are beliefs, they are false beliefs, but this person believes them strongly. So you could have things like, oh, um I'm Jesus Christ that can save the
Yes,
world.
delusions. Yeah,
Yes. So I once
that's
had a patient that said, he's the one that owns Dangote group of companies, but he has,
grandiosity.
yes,
Grandiosity.
exactly. So
Yes.
he just put Dangote in charge of, all those companies. But so those are the things you look at. So this thing is not in tandem with
Yes,
reality. So those
not
are the
at all.
beliefs you're looking at. So there are many types. So which you may not be able to go into today. So there's hallucinations, where you have someone talking to themselves,
Okay,
so to
hearing
say.
voices,
Yes, you're hearing
auditory.
voices, you're seeing things that other people can't see, you're hearing things that other people can't see. For some people, you're feeling things that are actually not there. So someone could say, there's something crawling on my skin,
Okay,
there's a spider or
yes,
something on my skin,
yes.
and nobody else can see it, but
Okay,
that person can feel it.
wow,
They can also see it too.
wow.
Sometimes it's about taste. It's basically about your five senses, you
Okay,
know five senses of the body. So there's a distortion in what you're
That's psychosis.
perceiving. Yes.
Maybe we
So
should,
these are
yes, maybe
these
we'll
are the
have time.
major,
Yes, we'll have
yes, these are the
time.
major characteristics of, psychosis. Usually you find someone talking to themselves and all of that, but the truth is they are not talking to themselves. They are
They're
having
hearing
conversations with
voices,
people that
yes, different
they can
voices.
hear, yes, but other people
Talking
cannot
about
hear.
psychosis, I think I mentioned this some time ago when at the mental health seminar I had sometime last year, that one day I came out from mass, and then somebody came to meet me. A young
Yes.
boy came to meet me, and he said he was hearing God speaking to him at all times.
Exactly. This is
I say
very
sometimes,
common.
yes, that sometimes God will speak like a woman,
Uh,
and God will speak like a man, and God will speak like a child.
mm.
So, as a mental health professional, he said it was God that was speaking to him. As a mental health professional, I knew that there was more to
And
it.
also as a spiritual
And then,
authority.
of course, as a spiritual authority, because sometimes we mix these things up.
Yes.
Sometimes spiritual experiences with mental issues.
Yes.
And that's why oftentimes it is important that we are able to make that distinction. That's where professionality comes
Yes,
in.
yes,
That we
yes.
have to engage professionals. Oftentimes in the church we say that there is need, even in spiritual direction, or we say that there's a need when there's a point we get to, and we say, this one we need a professional psychologist. So I was able
Yes.
to speak to him, and then the rest is history. But I told him what to do, and he was able to find help. So
That's very
psychosis
good.
is important. We shall find time to discuss more
Yes,
elaborately
yes.
about psychosis. But because she was saying that, depression can be comorbid with psychosis, happening alongside psychosis, and she has mentioned some symptoms of psychosis
Psychosis,
and all
yes.
that. So let's move on depression. We have talked about the signs and symptoms of depression. Lots of interest in activities one's enjoy, low energy, low mood, and all that. Now let's talk about the
Of course,
causes.
there's also irritability too.
Irritability, yes.
And in children, that's something that it can be a major indicator that this child may be depressed.
Okay.
So they would exhibit their own depression differently from what an adult
Can
would.
you explain what irritability is?
Yes. So you're easily irritable. Things that shouldn't get you angry or irritated are getting you.
Okay.
Irritated. Maybe I come and I greet you.
Okay, and then you
Hello,
just
good afternoon.
say, I beg.
Yes.
What is good about
But
the
the
afternoon?
afternoon, and all of that.
Okay.
So yes, so irritability is another.
Okay,
thing
so
to
let's
look out for.
continue. Let's talk about the causes. Depression is, we have established that depression is a mood disorder.
Yes.
So what could trigger depression? What could cause depression?
Okay.
There are certain causes of depression. So can we
Yes.
discuss that? Can you just mention some of them? I know there are many causes, but
Yes,
maybe we just
there are.
identify
Okay.
some of them and just talk about them. So what are the causes, possible causes of depression?
Yes, possible causes. First of all, genetics. So this may sound, absurd, but depression can actually run in families, just like you have high blood pressure, diabetes, and all of those illnesses running in families. Depression can also run in families too. So you have a biological formation. Maybe this person was born like this.
Okay.
Maybe that's why when you're having a clinical assessment, you're trying to go back to as early
Family
as
history.
yes, family history. How was this
Childbirth.
yes, how was this person's
Childbirth.
pregnancy?
Yes.
While
Yeah.
your mother was carrying you, the birth process and all of that. Sometimes it could be complications, that could form your own biology.
Okay.
So those depression can also be biological. You definitely also have psychosocial issues where you have happenings in the environment. Yes,
Life challenges.
where you have life challenges, sudden life changes.
Yes.
Someone just suddenly lost a job that he had. He had put all
So
of
much into.
his life into.
Very
Yes.
true.
Or had an accident, for instance, or a house burn. So sudden life
It
changes
could be
can
a
also.
heartbreak too.
Exactly.
Could be a heartbreak, a
Yes.
broken
Had
home, broken
yes,
marriage,
yes, yes.
and all that. Broken home, broken marriage, and
Yes,
all
all of
that.
those things can
Traumatic,
also
very
traumatic
traumatic
events.
experiences,
Yes.
events, and all that. And talking about that, what about, okay, from the biological point of view, what about the brain chemistry? The
Yes.
brain chemistry,
Brain
explain that in the
chemistry.
light of maybe the chemicals in the
Okay,
brain.
so brain chemistry can also be under, biological. It can be under genetics too. When you
Okay.
have, neurotransmitters, uh, functioning
Shed,
different from
yes,
how they should
imbalancing, yes.
function. Definitely, yes. So there's an imbalance. So some are secreting, higher than they should or lower than they should. It's a deep conversation. There are so many of them, that can be that in the brain, the human brain, can be responsible. So neurotransmitters, those are the chemicals in the
In the
brain.
brain that we
Yes,
talk about. So the
yes.
brain, oftentimes I say, is a complex organ that
Very
has a lot
complex.
of departments, and then we have the chemicals in the brain. And with
Faculties and
regards to,
departments.
yes, faculties and department, and with regards to depression, I think that the neurotransmitters, basically serotonin and dopamine. So what she's saying in essence is that we oftentimes, if there is a depletion or there
Yes.
is an imbalance in the secretion of any of the neurotransmitters, there is
Many of these
likelihood, most
neurotransmitters,
especially serotonin and dopamine. For
dopamine.
instance, now there's a depletion in serotonin and dopamine, the person is likely to be depressed. So other causes, apart from this, that you talked about life challenges.
Yes.
It could be economic issues too, just financial issues. If you don't have money, that's why I say depression is actually the malaria of mental health,
Yes.
because sometimes people say, who is not depressed in Nigeria? Looking at our reality in Nigeria,
Yes.
because
Yes.
it's either you are battling with, the fact that you don't have money, you're looking for money to pay rent, you're looking for money to cater for yourself, you're looking for this and all of that. You
And
go
then
to the market,
yes,
and then the prices of things
exactly
have
where I was going
changed.
through.
So
In a
these,
country like ours, where you have sudden life changes, like sudden change in dollar rates, you just go to the market, whatever you budgeted, is not the same thing
yes.
with what's in the market. It can, get you into depression. Of course, there could be other things too, but that alone, is possible because we are different. We are, as individuals, we are different in our formations and all of that. So what I may be able to handle well, you may
Another
not,
person
or
may
another
not.
person may
Now,
not
this is important.
may not be
It's
able
like I
to.
should delve into this discussion. This is important because what informs a situation where somebody would have two persons who would have the same experiences,
Yes.
maybe traumatic experiences. One person may have depression. I would have talked about the other anxiety disorder, but we'll talk about it, subsequently. One person could have depression and the other does not have depression. Or, so what can we say would inform that kind of a situation?
Like we said, we're different. We have different genetic formation, and we also have different
Personality. Do you
outlooks.
think that personality also plays a role?
Yes, yes,
Okay.
yes. It is a very big factor, in that's why I said so. For one person, a lot of people that you say this person, no matter what happens, this person is always gallant.
It's
They
always calm.
Yes, this person was able to chest this thing well.
Okay.
But for another person, the person is crying, is all moody, and all of that. So yes, it is a very
Yes, why
big
I say this
factor.
discussion is important, because we need to actually be conscious
Yes.
of people's differences in personality. Because you can tell somebody, you are stupid, And then the person takes it, oh, so you didn't know I'm stupid. Maybe that's the person's personality.
Yes.
And then he's able to just find a way around it and move on. But another person, you say you are stupid, you have spoiled the person's day for the entirety of the day. So I think it is very,
And
very
then
important.
yes, what I was going to say was your outlook on life, which is something that you have explained a bit with that example.
Okay.
Yes, that you gave. So for one person, they cognitive distortions, some people have a lot of cognitive distortions that would inform how they react to
certain
to certain events
in
around
their
them.
lives,
Yes. So for someone who believes that, oh, for me nothing good ever happens to me, or I don't ever do anything good, so
Okay.
whatever happens, this person has already tilted towards that side. So it's very easy for depression to come. And yes, I usually say that depression has a cycle. So on one side there's inactivity, and then on the other side there's depression. So it's a cycle that keeps going round until you are able to break it majorly with activity. But sometimes when you're I'm not saying this, that's why I want to explain it. I'm not saying this as a form of diagnosis.
Okay.
So you have to get, if you're experiencing something like that, you have to see a professional to be able to diagnose and say, this is a treatment that works for you.
Okay.
But that depression cycle I'm talking about, inactivity leads to depression. Depression can also, inactivities can lead to depression, and depression in itself is characterized by inactivity.
Okay.
So the idea is
very
to
important,
break that
very,
cycle.
very important point. Very, very important point. Can we also say certain illnesses like chronic illnesses like diabetes or cancer can lead to depression?
Yes, terminal illnesses.
Yes.
So diabetes, cancer, heart disease, all of those things. Because if you just picture it, how can me like this be diagnosed of HIV? How can I be diagnosed of heart disease? So that reality hits that person, and then they are not able to accept it. So it could lead to depression as well.
Okay.
Or it could happen. So they could happen concurrently, where we say they are co-occurring disorders.
Okay.
Yes.
Very true. Very true. Now let me ask this question. Now, who are those that can we say are susceptible to depression? Are there particular persons that are above depression? They can never get depressed, or that? What do you think? Who are those susceptible
anybody
to
can
depression?
come down with depression.
Okay.
Anybody can come down with depression. And that, if you remember, we're talking about children.
Yes.
So if children can also be depressed, so because for one person, they could be saying that, oh, I don't know how to cater for my family, my source of livelihood has been tampered with and all of that. So that may be what could lead someone into depression. But when it comes to a child, so for someone who thinks like that, how do you now come to terms with, oh, what's that child bothered about when he has that cover, parents taking care of him or guidance taking care of him, and then they are coming down with depression. Why?
Okay.
Because depression is something that can happen to anybody. Once that the chemicals in the brain responsible for mood control are tampered with, you could come down with depression. And on the other side of it, I think it's just good we talk about this. There's bipolar disorder
yes, I want to,
on
okay.
the other
Go
side,
ahead.
which depression is a major symptom of bipolar disorder.
Okay.
So, but because someone is depressed does not necessarily mean that they have bipolar disorder. It's probably a conversation, we could
Yes,
have
a conversation we should
on a
have
separate
another. Yes,
day.
bipolar disorder is also
Yes.
a mood disorder.
Yes, it's also a
So
mood
we
disorder.
shall be having that conversation subsequently. Now we are wrapping it up, but it is important for us to say this also, that substance use.
Can also,
We didn't talk about that. Yes, can also
yes,
lead to depression
yes, it
and
can.
other mental
It
illnesses or
can.
mental disorders.
The mechanism is something that, if we're wrapping up, we may not be able to go into it. But yes, substance can. So for alcohol, for instance, for some people they could say, this it helps me lift my mood. But what
Okay.
happens when that alcohol has, gone out of your system? So you're likely to be depressed, coupled with other factors that may be present already. To know
Okay.
if they combine with alcohol, in your system, that has thwarted a lot of things, then there's a chance that person can be depressed as well.
Okay, now let us just wrap it up by talking about diagnosis, right? How can depression be diagnosed? How can depression be diagnosed? Do you just begin to feel some of these symptoms and say, I have depression, I have clinical depression, or what should somebody do? So how can depression be diagnosed?
Depression can be diagnosed by a professional, and professionals know, what to do, or tools to use, parameters to use. So we've
Okay.
been able to talk about some symptoms and all of that, but this person is able to help you ascertain, has this been up to 2 weeks?
2 weeks.
You've been experiencing these symptoms, and how consistent have these symptoms been? So if there's only a change in your sleep pattern for one
Okay.
week, or 2 weeks, the professional knows what to do, basically. So there are tools that, that we use. There are parameters that we use, so that can be done in a clinical assessment.
Okay, so thank you so much.
So basically, but if you're having these symptoms for, these symptoms I've mentioned for at least 2 weeks, and they are persistent,
and
then
consistent.
then you need to see a professional to help you, come up with that diagnosis, and then you can go into treatment.
Very good point, very important point, because what we are trying to do here is not just to create awareness, but also to tell you how to seek help.
Yes.
And where to seek help. Now, in our next episode, most likely, we shall be mentioning a number of perhaps mental health facilities, because I've heard people say that, okay, even if I have this, where do I go? Who do I, where do I find psychologists? And I usually say psychologists are everywhere.
Yeah, so the professionals we are talking about in mental health, professionals are psychologists, clinical psychologists, psychiatrists, clinical social workers can be able to help you. Mental health nurses can also, help direct you to where you can get.
So that's
it.
We shall stop here, but we shall continue. We have not talked about treatment and management, which is very, very important. Which is very, very important, and possibly prevention as well. It is also important for us to talk about that. So on this episode, we shall be wrapping it up.
Okay.
Remember that mental health, there's no health without mental health. So we shall continue next time on this episode. Remember we say this is peace of mind, and today we are talking about depression. We shall continue when we talk about the treatment and the management of depression, and possibly we shall be talking about prevention. Not possibly, definitely we shall be talking about prevention. So join us in our next episode, and remember to follow us on all our social media handles. And I remain your host, Reverend Father Istifanus Sheyin, a clinical psychologist, with my able and proficient guest here with me.
Thank you for
Fanan,
having me.
Yashi-Nyakan. That's your name. That's your name. But I will try to rehearse it.
Well,
Thank you
Father.
so much,
Thank you for having
and God
me.
bless you. See you in the next episode.